Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
What is causing your hip pain? Femoral acetabular impingement, or FAI? Are you having a labral tear? How to tell? These are a mouthful, Brad, but we'll go over what they are.
Yeah, it sounds a little intimidating, but it's really not.
Yeah. So femoral acetabular impingement. Let's break it down, Brad.
That's right.
So this is the femur. I pulled it off Sam here. That's the biggest bone in the body, if I remember right, Brad?
I think you're exactly right.
And it's got a ball on the top of it.
Right. The femoral head.
And that ball fits into a socket. It might be better to show on this one. Fits into a socket, and that forms a ball and socket. And that's the acetabular.
Right.
So that's the femoral, and that's the acetabular.
It's a very stable joint. It's designed to hold a lot of weight. Obviously, your whole body weight goes through, or most of it,
right.
with impact as well.
And supported by some heavy ligaments too,
sure.
going around it. But what happens in femoral acetabular impingement is that either you're born, you can show that side, Brad.
Sure.
Either this is misshapen, the ball is not shaped quite like it should be, and you're born that way, or the socket is misshapen.
Right, so this is the acetabulum.
That's the acetabulum.
And that can be, you can see the blue lines in here. It should fit in there real nice. It's a good fitting joint, if you will.
Right.
But there can be anomalies or problems with the shape not being correct.
And they could both be misshapen.
Sure.
And what happens then is it obviously grinds and rubs together and creates pain, but it can also damage the cartilage inside.
Right.
And here, Brad and I, with our advanced digital graphics,
we are in the age of wonder.
We took and I just outlined what the labrum looks like. Now, that's the cartilage of the hip, and that's kind of the shape of it. It helps hold, cushion it a little bit. It helps hold the hip in there. And that can get all messed up when those are misshapen, as you could see, especially over time.
You want to have a lot of surface area, and that's what it is on a healthy one, but on these misshapen ones, you get pressure points, and that's where it wears away that cartilage readily.
So yeah, over time, and I've had about 3 patients like this in the last couple of years.
Sure.
And they're all girls that were in their early 20s. So they were all athletes, and they were all competing for a while, and they couldn't anymore because it was just too much pain.
So what was the end result?
Well, they all 3 had surgery.
Oh.
Yeah, and surgery is not unusual. Again, you see it in a lot of athletes, but you can see it in adolescents and adults also. And again, usually present at birth. Each case, they had the surgery to repair the damage and the deformity, too.
So the athletic or the activity did not cause it. It was already there, but the activity kind of accelerated it.
Right. So with FAI, and which can lead to the labral tear, again, remember the labrum in there, you may not have any symptoms. I mean, there's people, as you get older, you may go through your entire life without having symptoms, especially, I think, if you don't do sports.
Sure, where you're stressing it.
But we'll go over some of the symptoms. And some of these symptoms to me aren't really helpful, Brad, because you find these with a lot of hip problems. But
they overlap other problems.
Nonetheless, here they are. Stiffness in the hip joint. Obviously, that can be with a lot of things. The hip joint, this is probably one that's more indicative. It may lock or click or catch.
Sure.
And that's the labrum getting caught, or even part of the bone maybe getting caught.
I know my sister has this symptoms. She's 50 years old now, but she showed me 15 years ago, and she's had no problem. So I don't know. I don't know if this is a problem or it's something else.
She may have a tore labrum, and a lot of people do, and they are asymptomatic, just like you find tore cartilage in the knee, and they're asymptomatic. The patient may limp. Hip pain, if you're having pain, it's usually in the inner thigh or groin.
Sure.
That's where the problem is. The pain worsens with physical activity. It may get worse with even prolonged sitting because that's hips up like that, especially on a low chair, or like in a car.
Right. So you're sitting and your actually knee is up higher than the hip.
Yeah. Putting see how it's jamming that?
More pressure on that joint.
Right. So it also, of course, may be worse with climbing or doing stairs, which all hip problems tend to be worse with that.
Yeah, there's just more stress on the joint.
So the tests the doctor can do, they can do X-rays, MRI, CAT scan. The X-rays can show the bones, and the MRIs can show the labrum.
Right.
So,
The softer tissues.
right. So we're going to show you one test you can try yourself. This is a, well, you can't really do yourself. I'm sorry. You do need a friend or a family member
Sure.
to help you with it. But it's pretty easy to do. Brad, we'll have the leg facing this way is the one that we're going to test. So
Okay, facing the camera.
Yeah, facing the camera.
Okay, so you want me to
why don't you
be the guinea pig, if you
yeah,
will?
Why don't you lie down? Okay. So all you're going to do is you can grab person's leg or have someone grab your leg by the ankle
Yep.
and by underneath the
So
knee.
I should be relaxed?
You should be relaxed.
Okay, put
I'm
this
just-
leg down
yeah,
or up?
that down, yeah.
Down, yep.
I'm just going to bring it up to a right angle. See, this is a right angle. You can see really well with the stripes, and that's at a right angle.
Yep.
Very easy. Bring it up to this point. Now I'm going to bring it across to the other hip.
Okay.
All right. Now once it's across, I don't know if you can see this or not, I'm going to bring the ankle out like this.
I've got a healthy hip. And
No-
this
no
is,
pain?
This
All right.
is, no, but it's like not really
Not real comfortable, no.
Right.
Because we're really jamming the hip here.
Yeah. Putting it to end range, if you will.
Yeah, so I don't need to push down at all. All I'm doing is bringing the ankle out like this.
And you're not applying a lot of pressure.
No, I'm not going. I'm not, am I?
No. Well, no, you're not, but I can. It's
You can
like
feel it.
I'm thinking just be nice.
Yeah, gentle, gentle.
Yes.
Internal rotation.
Yep.
And I did this actually on a girl that was not diagnosed with this yet.
Sure.
And it was so positive. I'm like, and
So she became clearly painful.
Yes,
And like
yeah.
apprehensive. Stop.
no, but it was just, it hurt.
So
She
then
didn't
you
become
could
apprehensive.
compare to the other
Yeah, I
hip.
compared to the other side.
Sure.
Which you always want to do.
Yep.
And it was unfortunate with this girl too because she was a very good runner. This one that I diagnosed it in,
Yep.
and she ended up having to give up her running career.
Oh,
I mean,
boy,
it was
that-
tough because she
that
was
would be tough.
she was on a state team and one of the state runners. So,
Yeah.
so it can be a drag.
Yeah, maybe
So-
she'll find another activity.
Okay, remember this video is a part of a series of videos on hip pain. You can go to bobandbrad.com, go to the programs section,
yes.
and you'll see a list of all of our hip programs and
This is going to have a PDF.
a PDF. Yeah, it'll have a printout. Every video we have is a printout.
Right.
Every video we have is free. We don't ask for an email.
On the program
On
section.
the program section.
Right,
So,
it's a good deal.
yeah, check it out. Can't lose.
What does PDF stand for?
Mike?
Nobody
Nobody
Well, you
knows.
print it out.
Yeah, you can print it out.
Very good. Good luck
Good
and
question.
take care.